Hello and welcome to a COVID-19 update special for the town of Pembroke. I'm Donna Rodriguez. I'm going to be hosting this episode today, and I'm very thankful to be joined by Bill Chenard, the Pembroke town manager, as well as Lisa Cullity, the health agent. Welcome, both of you. I'm glad you could join me today.
Pleasure to be here.
Good morning. Thank you for having us.
Well, why don't we just get started, because there's so much in the news, there's so much happening. It's hard to keep track, and I think it's important for all of us to really have an understanding of what's happening in our towns and in our communities so we can make safe decisions for ourselves and our families. So I'd like to start there. Give us an update about what's happening in the town of Pembroke when it comes to community transmission and numbers with COVID-19.
So to let everyone know where the current Board of Health is with this, people are probably aware that the contact tracing collaborative at the state level has been shut down. The state is no longer doing contact tracing. We have moved that in-house to the Pembroke Board of Health with our own public health nursing staff. We are moving forward with that. We are still seeing transmission of cases, of course. I don't think anyone is unaware that we had a spike this fall, which was not entirely unexpected. It was a little higher than we would have liked, for sure. But we continue to follow up with those cases. The really good news coming out of this is everyone that is vaccinated that has in fact contracted COVID-19 has had very mild symptoms. Some of the comments I'm getting from people are, it feels like a bad cold, to I didn't even know I had it. And that's wonderful news. So the high point to take away from this is, while we are seeing breakthroughs, both the Delta and the Omicron, that the people that are getting sick that have been vaccinated are not getting very sick. So the takeaway from that is, if you're not vaccinated, consider it. If you have concerns, talk to your primary care physician about them. And if you have been vaccinated for more than 6 months, consider getting a booster. They're very readily available. CVS, Walgreens, all of your walk-in doctors' clinics seem to have them readily available. You can make an appointment and get in just a matter of days.
So if people go to mass.gov, they can click right on the COVID-19 updates. It's a tab on the upper menu, and that can lead them right into making appointments. So whether if somebody is looking for their first vaccination, their second shot, or a booster, they can search in their local community to find the locations and make appointments. And it's moving along fairly quickly from what I see. Is that being your experience, what you've been hearing, Lisa?
Yes, it is moving along very quickly. And as far as the conference call, the state continues to remain in very constant contact with all boards of health. We have a minimum of one meeting a week, sometimes more than that. And yes, the push to get vaccines out there and readily available, there seems to be no major supply issue as we had, of course, previously. Again, all your major distributors have them. Your good, reliable information, as you mentioned, the mats.gov site remains excellent and up to date with links to where to get those things, but there does not seem to be any lack of availability or supply chain issues associated with it.
So, Bill, tell me, from the town's point of view, some of the work that's being done, in town hall as well as other locations, what are some of the guidelines that you have currently to ensure that everybody is maintaining safe distance?
So we recently went to virtual meetings, at least for a month through the holiday season, where people have a tendency to get together. And we saw a little bit of a spike after Thanksgiving. So we went to virtual meetings. That's the first step. Our buildings are open to the public. We are providing service to our residents. We are taking precautions. We're doing extra cleaning, extra sanitization. Not having the night meetings in the building allows us to do that. And get them clean. We have plexiglass shields for our employees. We do have a mask requirement if you are not vaccinated. We ask you to wear a mask. If you're vaccinated, you do not have to wear a mask in our public buildings at this time, with the exception, obviously, of the schools because of the DESI requirements. And I think taking personal responsibility is a key to this. If you feel that you're at risk, and you want to wear a mask, please, you're not at all going to be questioned for doing that. We would absolutely encourage that. And so we think we're taking the steps necessary at this time. We continue to monitor our cases. We continue to monitor and talk to those, people that have had the virus or are currently infected with the virus. And as Lisa said, The cases seem to be not at the same severity level if you have a vaccination. So we're encouraging you to do that. Talk, like she said, talk to your physician, get out there, get it done. Our vaccination numbers are pretty good in the town of Pembroke, especially with our senior population. We're well over 90%. I think we're close to 96 or 97% now, which is really, really good because the most vulnerable population has been vaccinated, and that will result in less severe cases if people do have breakthrough cases.
That's fantastic information. And the town has been so committed all along to educating residents and assisting them where needed to get access to the care or vaccinations that they need. Tell me, what are some of the typical questions you're getting from residents right now? Are people more concerned with everything that's they're seeing in the news, or are people feeling comfortable with the support that they're getting locally?
It's all over the place. I wish I
Okay.
could say there was just one answer to that. The reality is we have people that are highly concerned about the new variants and highly concerned about what that means for their own safety. And we have other people that are very much business as usual, that they are very comfortable with the situation. They're very comfortable with whatever choice they've made, and they're ready to quote unquote get back to normal. And the reality is we are moving in the direction of normal, but the variants are going to be out there. This disease is probably going to be with us for multiple years to come. This is probably going to be a vaccine we're going to see associated with the flu shot every year, probably for years to come. So you're seeing a whole panorama. And even in the town of Pembroke, we see the whole panorama of response from very mildly concerned to extremely concerned. And that's a very, very personal choice that everyone needs to manage on their own. For example, many local shops, Stop and Shop and others within the town, you will see people routinely wearing masks. And I think that's great. If it gives them a level of comfort or they have any concerns, maybe they are medically predispositioned to be more susceptible to COVID, so they're taking all those extra precautions, that's great. And you see other people that are not, that are much more comfortable in moving about their day-to-day business. And that's good too. I think people need to make the choice that is right for them and their families. And I think that to eliminate risk where you can is a good thing. Not having huge gatherings with lots of strangers, as the town has done to move to more remote meetings, not have unnecessary large groups of people inside. And I think those are the kinds of precautions we want to take right now to ensure that our numbers keep moving in a good direction.
Now, Lisa, I'm curious. I have a question regarding at-home tests. Rapid tests. We know that they're becoming more available, where they were very difficult to access even a month ago. But now we're able to order them online. We're able to find them in local pharmacies. Are there any recommendations right now as to where those might be appropriate? My understanding is, people might want to take a test before getting together with family over the holidays, if they are, even with a small gathering, or before returning to work after the holidays. Are there any guidelines you're hearing from the state or recommendations as to how we should choose a test, or if we should even do one at home?
So no, not really, but everyone's situation is going to be really unique. And I think that's why we're not going to see a big recommendation from the state. The times when I would consider using an at-home test, yes, if I'm going to have a bunch of people over my house for the holidays, particularly people that are highly susceptible, that's a time I might consider taking a test myself. If I know I've been exposed to someone, of course, I'm going to take a test. An important thing to remember about these at-home tests, though, you are paying out of pocket for those costs. That is not an insurance-covered item under many insurances. However, if you are exposed to someone that is positive for COVID-19 and you are a direct contact, of course, that is still covered by your medical insurance. But most of the time, those at-home kits are not going to be covered. You're going to need to seek a traditional source, such as a pharmacy, a doctor's office, a walk-in clinic, to have those costs covered. So I would say that the at-home tests are more for your own peace of mind. Maybe you have upcoming travel plans or things like that you might want to know what your status is. I think those are excellent for that. But if you have reason to believe you are actually in any kind of medical exposure or jeopardy, I think you want to then refer back to your doctors or walk-in clinics or a medical professional to help guide you through that process.
And I think that's a wonderful point, and especially considering that with the at-home tests, many of them are not accepted by, if you're traveling on an airline or if there's a place that you have to show that you have tested negative. Many of those are not accepted in those situations. You would have to have a PCR test done at either, a pharmacy or a doctor's office. Is that correct?
It depends on where you are traveling to.
Okay.
Some places are insisting on the PCR tests. Others are acceptable of the antigen test based on your destination. So I think in the case of travel, depending on where you're going, you're really going to want to check that out. What does your destination require? What does your airline require? Things like that are going to be a factor in which test you should consider and where you should consider getting it to make sure that the test you get is acceptable to your destination or fits with the plans you have for it.
Thank you. And to both of you, I think you both made wonderful points about what the town of Pembroke is doing to ensure people are feeling comfortable in their locations, and that how people choose to conduct themselves is really about personal choice and personal responsibility. But as we all know, the discussion about potential mask mandates is really heated up again across the country and across the state. There has been a lot in the news in the last several days in talking about this. The CDC has recommended that any communities that show substantial or high transmission, they should consider going back to mask mandates for indoor public settings. Even the Mass Medical Society came out with that just in the last day, making that recommendation. And at the same time, Governor Baker has made it clear that he's not looking at that right now. So there are lots of opinions and people working through it right now. For the town of Pembroke, what will your steps be, or what is your process to determine if you would ever go to that point? What would the steps be that the town of Pembroke would follow to make decisions if you would ever go back to mask mandates?
If a mask mandate were to come out from the Board of Health, what would happen is a Board of Health meeting, of course, would be scheduled. An agenda would be posted. Mask wearing or mask mandates would be on there as a topic of consideration for the Pembroke Board. That is a public meeting. Obviously, it's going to be a Zoom meeting at this point out of safety, an abundance of caution for safety. But then it would be discussed and people would be able to speak to that, and the board would discuss that in an open meeting. It was a topic on our board meetings a few months ago. I've not been notified that it will be a topic upcoming, certainly. But the kind of things that would drive whether or not the board would take up that topic again would be spikes in cases, large community spread that is unexplained. For example, large community clusters, maybe within a certain location or a certain demographic. Things like that would suggest to us, rather than single person to person transmission that might have been from work or from a single gathering or from travel or things like that, we would be looking for incidences within the community that led to, again, a cluster, a large explosion of cases. That would tell us we have an actual internal community human behavioral issue that is driving a spike in cases. And I would imagine that that is going to be a concern for the Board of Health to take up as a topic if they were to take it up.
Thank you.
And one additional piece there. Sorry.
Oh yes, Bill, go
it's
ahead.
an incremental thing when we look at mandates related to that. It's important to consider the other steps that we're taking, like virtual meetings, like doing, cleaning in our public buildings to make sure that we are sanitizing. We've been very fortunate in town hall. I mean, we've had a couple of cases of COVID, but neither person caught the virus from being infected in town hall. They were infected, one on vacation, and I forget the other one. But if we can continue to service the public and not have cases like that by taking incremental steps, and we don't need to have a mask mandate. But if the numbers indicate that we do, then we will certainly be looking at that.
Are there any additional areas or topics you would like to touch upon today related to COVID?
I actually have one thing, Donna. Well, actually two things. One, people can get vaccinated from age 5 upwards now. If you're a parent, you seriously consider that, as we have said. If you're not vaccinating yourself, seriously consider it. The studies are overwhelmingly in favor of getting the vaccine unless you have some condition where you shouldn't, and that's your decision with your physician. to reduce that. And I know I keep harping on that, but I think that's important. The other thing I wanted to stress is if you have COVID symptoms, if you have the fever, the respiratory problems, and there's a number of them, go to the CDC or the mass.gov site, they'll list those. Immediately go and seek treatment, get a test, because since day one of COVID, where we didn't have a lot of treatment protocols, the treatment protocols are vastly improved and will reduce your symptoms and potentially save your life, especially if you're not vaccinated. So seek treatment, talk to your physician if you do have the symptoms, and as I said, the treatments that are out there today are vastly improved.
And it's also important for people to seek treatment early rather than wait until it's at the point where they're significantly ill.
Yeah, because some of those treatments are much more effective or if you seek treatment early and start the treatment early in the process. Some of them aren't effective at all if you wait, several days before seeking the treatment.
Thank you. Lisa, is there anything you'd like to add?
One question that comes up when it comes to mask discussions and other discussions, and why is the state, the question being, why is the state not mandating this all again? And I think there's a significant difference today from the mask mandates that we had last fall, and that is that the vaccine is available. And it's widely available, and it's available for everyone 5 years of age and up. And I think that is the single driving force why we're not seeing the state turn around and say, oh, we should have a mask mandate in the secondary surge or whatever you want to call it that we're seeing this fall that is now seemingly beginning to abate. And that's the fact that it goes back to people have a personal choice, and masks are not the end all be all, and vaccination is not the end all be all. It is all of the things combined together. It's increased sanitization. It's being aware if you're ill and staying home. If you have even a cold, it's being aware of your medical choices and making good ones. It's not having, large gatherings, if you can avoid it and until it's safe to do so. All of those factors go into community spread. All of those factors go into a case count. Not just masks or not just vaccination. It's a multi-pronged weapon that we want to use to defeat COVID or avoid getting too sick with COVID, as well as seeking medical treatment early. So all of those factors play in. So it's not as simple as saying, if we just do this, then that. All of these things apply, and everyone needs to make those choices for themselves and take personal responsibility for them.
I think that is a wonderful point, that it really is, it's important to have a holistic approach, that you're looking at everything, your overall health, caring for your health, preventative measures, as well as if you are or a family member is sick, what do you do to protect yourself, your family members, and the people around you, whether it be in school or work. So it is truly multi-pronged. I want to thank both of you for joining us today for this conversation. And again, I'm going to point folks to mass.gov if you're looking for up-to-date information and accurate information, where you can go and get a test if you want to see the numbers and what's happening in the town of Pembroke. All of that can be found on the state website. Numbers and information are updated Monday through Friday at 5 p.m. And if you just click on the COVID-19 tab at the upper menu on the website, you can get directly to all of that information. For this episode with Bill and with Lisa, you can get more information about how to view it on the Pembroke Government Channel or on demand by visiting the Pembroke page on the PACTV website, which is pactv.org/Pembroke. You can also, if you are a YouTube viewer, you'll be able to see this episode on PACTV Video Share on YouTube. If you just click on the COVID-19 playlist, you'll be able to find this episode as well as episodes that have done in the past. Again, thank you both so much for joining us today, and I wish you all happy holidays and a healthy holiday season.
Same to you, Donna.
Thank you.
Take care.